not taking a lot of time of yours, I would love to introduce Dr. Rohan, who has himself cleared USMLE few years back, and every year he teaches a lot of students and help them to reach to that level. So, Dr. Rohan is currently practicing at W Hospital in Gurgaon, where he is a consultant setting up breast unit for their oncology services, and he has worked with Max Saket in past. He's a graduate from Safdarjung Hospital. Um, he has worked with Narayana Hospital as well, and he has done his fellowship with University of Maryland in USA. Uh, After clearing the USMLE exam. So, he would really give you a lot of insights about USMLE, and I hope you have a great session. All right. So here's Dr. Rohan for you.
Thank you.
Thank you very much for the kind introduction, Nipun. I can see a lot of familiar faces in the Hangout as well. So Nipun has already introduced me, so I'm not going to talk about myself. Dipansh is here, Dipansh Gupta. He just snatched into MD Internal Medicine program at the University of Tennessee. And this was his first attempt, and he did really well and got matched in a university program. So Dipansh is going to be helping me out in this webinar, and he'll be guiding you as well. So Dipansh, if you could just say hi to everyone, and then I'll move on from there.
Thank you so much, sir, for the kind introduction. Honestly, I was in a similar position as you guys are 2 years back, and it was through Dr. Rohan Khandelwal's very good guidance and support throughout that I cleared all my USMLE exams that I've matched this year. I am going to start my training in July, and we are here to answer any questions that any of you have.
Thank you, Dipansh. I can see John as well. John Bennett, he is a retired emergency medicine doctor who's joining us from California. I'm sorry, Miami. And John and me go a long way, and we've conducted many hangouts in the past regarding USMLE. And John, if you could just say a few words before we start.
Yeah, it's good to see you. Can you see me? Can you hear me okay, Rohan? Can you hear me?
Yes, we can, John.
Okay, great. Good to see you again. And welcome everyone to this wonderful platform of Google Hangouts. You know, when I had a hangout with Rohan probably about a year and a half ago, and that showed me the true power of the Hangout. Now look at all these people on the panel. It's just fantastic that we're interacting this way. And let me just tell you quickly, Rohan, that I'm doing medical conferences online now. I did a conference on brain tumors, and I had neurosurgeons from Canada, USA, Mexico, Ecuador, Brazil, Ecuador, Colombia, Russia, Iraq, and Belgium, all on the screen here. So you can see how powerful it can be. And I can't stay long, but it's great to see you.
Great to see you, John. Thank you. Right, so let's come to the point. So the seminar, the USMLE, and how to prepare for USMLE and how to build a strong resume for your residency application. Now, I've conducted this seminar many times, and there'll be certain questions which are the routinely asked questions, so I'll try to cover them beforehand only. Otherwise, if you have any questions, you can either post them on the chat box or on the Twitter handle through the hashtag USMLEdecoded or on the Curofy app. Right, so USMLE, which is the United States medical licensing exam, you have to clear this exam if you want to practice in America, right? And this exam it's unlike the Indian PG exam where you just crack one exam and then you straight away go to the counseling and you can choose the subject of your choice depending on your rank. This is a bit different from that. Can everyone just put their mic on mute? Otherwise it creates a lot of background noise. Right, so the first point is why is everyone wanting to go to America? One is, of course, the quality of life is better there. That's what most of the Indians think, and it is true. And I'm sure John can vouch for that. And the other thing is that the quality of medical education and medical training is much better in that country, in America. Of course, the pay which you get in America is much more than what you get in India. So these are some of the common reasons why people are wanting to go to America. I also feel that the Indian medical system is not encouraging its doctors to stay back. It has become a very negative system where they are just focusing on cramming up a lot of information, and the doctor-patient relationship in practice is also suffering. So that is also probably one of the reasons why people are flocking towards America. Now, the USMLE exam, it typically takes place over 3 steps, and the preparation for the exam, if you've made up your mind, the actual preparation should start ideally when you're in first or second year of medical college. Now, I know this would take a lot of people by surprise, but that is the fact that if you don't start preparing when you're in second or third year of medical college, it will become very difficult for you to build a strong base for the exam, right? Now, so how we are going to divide the seminar is that first we are going to discuss in detail how to build up a strong resume for the exam, and then we'll talk about the individual exams in detail. Okay. So before I continue any further, if there are any questions, I would be happy to answer them at this stage. Any questions from anyone? All right. So if there are no questions, I'll move ahead with how to prepare your residency application, how to prepare your resume for that. So the first thing when it comes to preparing a resume, a strong resume for the USMLE exam, is you need to have a strong base. And by strong base, I mean that you need to study your books really well. And by studying your books, you are widening your horizon, and by that I mean standard textbooks, not the books which you read at the last moment to clear your exam. So that's a very important thing, and that you should do from first to second year is to read standard textbooks, right? Standard textbooks are very important. Now, another very important thing which you can do early on in your medical education career is to get into research, right? Is to get into research. And research is something which Indian students were lacking. Say, if I say 5 years back, 1 in 100 student was publishing their data or had a public. Now the trend is changing. A lot of students are getting active in student organizations, and they are actively taking up research projects. So that's a very healthy thing to do. And some of you who have joined the webinar, I'm sure you're also doing some projects. So I'll ask Deepansh and Charu. Charu is also he is just graduated from Vardhaman Mahavir Medical College, and he's also preparing for his USMLE exams. So Charu and Deepansh would talk about this, and then we'll continue the seminar from there. Deepansh, why don't you tell us about some of the research which you've done, and how can medical students get into research in our country?
During my second year of med school, I applied for the short-term studentship by ICMR. I took the guidance of Dr. Neeti Khungar in dermatology, and I worked on a project on association of psoriasis with metabolic syndrome, which was eventually accepted by the ICMR and was published as well in Indian Journal of Dermatology. After that, I went for my rotation in the US. I've heard this line or this say by a lot of people that it's very difficult to get research in US, and how do you get research in US? I'll just tell you how did I go about things, and probably you can take a leaf out of it. So during my rotations in the US, I was trying to be proactive. I was getting involved with the didactic sessions every day with the fellows, with the residents. See, you must understand one thing for sure, that the residents and the fellows that who are working there on a daily basis will always be involved in some project or the other. If they are convinced that you can be trustworthy enough to be shared the data with, they will give you something. And I happened to do rotations at 4 centers, and I worked on a paper in each one of them, and I managed to get a publication in at every place I worked with. And eventually, I would say, because of the relation that I had developed with people in the program, it helped me get interviews as well. So that's how I went about things.
So, Dipansh, do you think the short-term project which everyone applies for in second and third year, just a 2-month project, is it enough research for the USMLE exam? Because I feel what happens that they appear for this project and they clear the project in 2 months and then they stop working on it. And until and unless you get a publication out of it, I don't think so it will really help in the USMLE exam or
I will
residency application.
I will absolutely agree with you, Rohan sir, on this. Uh, People say that I have done so many years of research and blah blah blah, but at the end of the day, the research that matters is how much you've got out of it, and that is the publication. A publication or a poster that is presented in a journal that is PubMed indexed at least. And honestly, it's better if you get your publications in the US. I know initially it's very difficult when you're in India to get publications outside, but once you've done even 1 or 2 publication out here, it creates a good base for you to go from there, because you know how to go about things. And trust me, people will give you the opportunity if you're looking for it.
Charu, why don't you tell us about your experience? What research did you do during your MBBS time? And what is the importance of these bodies like IMSA and AMSA, which are coming up in a big way in our country?
Sure. Thank you, Rohan sir. First of all, I would like to know if I'm being audible to everyone. Am I audible to everyone?
Yes, you are.
Sure. So I would just like to start by saying that thank you, Rohan sir, for giving me the opportunity to talk about the importance of research in the entire journey of USMLE. During my medical school days, I started my first research as a part of the KVPY program of the Indian Institute of Science, which is at Bangalore. And I started my research in biomedical waste management, which was a public health topic. Later on, as just like echoing Dipansh and Dr. Rohan's thoughts, STS, like short-term scholarship project by ICMR, was very important as well. And being a member of organizations like AMSA and IMSA gives you a more opportunity and a better platform to show your work and be a part of conferences which are at state and local and national levels, and that can be recognized and can be even published, can get published. So that is very important. Right now, after graduating from my medical school, I'm working in Children's Hospital of Los Angeles at the USC. Just like Dipansh said, when I was doing my electives, 4th-year medical rotations at various hospitals, pediatric hospitals across the country in US, I was very overactive and proactive, and I was being a part of journal clubs and scientific meetings, not only in my concerned department, but in other departments which are of my interest. I approached a lot of professors, and they offered me very good opportunities to work with them, not only on case reports, but also on the lab work, even in the case like case data, literature review, data analysis. And later I was a part of the Public Health Foundation team in India as well as in the US to work on different types of statistical analysis. Publishing is important. Publishing your work is definitely important, but I would not just agree by saying that if your work is not published, then your research is not considered to be a very important one. Any research is considered to be, any amount of research is considered to be an added advantage on a resume, and it looks good. It shows you that you have, you have an added step, you have a better advantage as compared to other students, and you are definitely influenced by the term evidence-based medicine, which rules the entire medical system in the country, in US. So if you are proactive and you're working very efficiently, be it lab work or be it at a clinical research or a project which includes patient care, I think it is great. In 6 months of time or 1 year of time, publishing a work apart from case studies is definitely difficult. I wouldn't say impossible, because if you are enrolled in the phase 2 or the phase 3 of the trial, it becomes easy. But if you are able to explain during your interviews or fetch interviews and explain that how important was your role, or how you understood and how you have evolved during the entire course of the project, that will really fetch you an extra marks. I'm working since last September, last summer, in Los Angeles, and I'm looking forward for interviews this year.
Thank you, Charu. So the first and foremost thing when you're building a strong resume for the application, as we've discussed, you need to have research experience, you need to have publications, right? So that is number one, which you should keep in your list, how you can, and I've given you a few examples of how you can work on it. So the best would be to start from second year, get hold of a mentor who can, under whom you can do your research and under whom you can get it published. Now, in India, you know, a common issue is, how do I search for that person? So the best way to search for that person is to ask your seniors, which is the doctor who's publishing articles in the hospital. Those who are publishing articles, just go and tell them, look, please, I need your help and I'm willing to do any work you want. Come at odd hours and do this work. So all the research work happens at odd hours. If you think that you will finish it during your 9 to 5 college time, that doesn't happen. You have to work extra hard if you want to get this opportunity. So get hold of that person and try to do some research under them. Now, the second thing, which is very important, and a lot of students have been tweeting about it and writing on the Curofy app, is regarding US clinical experience. Now, US clinical experience, undoubtedly, this is one of the most important things when it comes to a strong application. Now, I have a few relatives who are residency program directors, and you know, they tell me how do they segregate or how do they filter out students when they apply for a program. So typically the first filter is in some of the places, and I'm not saying all of them, in some of the places typically the first filter is your USMLE score, your step 1 score, right? So if supposing 100 students have applied for a program, they would keep the bar at say 235. And anyone who is below 235 is automatically out. Okay, those who are above 235, the next filter typically is your US clinical experience, and US clinical experience would also then amount to getting good letter of recommendations. Okay, so US clinical experience is helping you in two things. One, it gives you experience in that country, which is very important, which is a very important criteria. And second, it gives you strong letter of recommendations. Okay, now you can argue and you can say that why can't Indian letter of recommendations work? The problem is that Indian letters, the American directors, the program directors know that most of the letters are written by the students themselves and the professors just sign it. And trust me, it is very difficult when you're writing a letter for yourself. It is very difficult to write good things about yourself, right? So those Indian letters are not that credible. So if you have, if somebody tells me I have an excellent Indian letter of recommendation written by my professor and have an average American letter of recommendation written by a professor there, I would say that that average letter of recommendation is going to do you more good than that good letter of recommendation from India. And I think so Dipansh and me were just discussing before the webinar. He'll give you an example about what happened during his residency interview. Dipansh, why don't you tell them about the letter of recommendation thing which you were telling me?
So during when you apply for your match, you need to get your application done by September 15. That is another very important thing that you should take into account. And a lot of people have very good scores, but they don't focus on the application. A good application will increase your chances of interview. A good application means good letter of recommendations and a very strong personal statement. We'll probably come to the personal statement a little later on. You need to upload at least 3 to 4 letter of recommendations, out of which 3 should be letter of recommendations from the US, and 1 could be a letter of recommendation from the head of the department to which you're applying. for example, the education of internal medicine in our college when I applied for internal medicine. Then during one of my interviews, I was interviewed by the associate program director, and he told me that I saw your letter of recommendations. So they have your entire profile with them when they're talking with you, or or at least they've read your entire profile before they speak to you, your personal statement and your letters. So one of the associate PDs told me that I read the letter of recommendations from Dr. So-and-so, and he had beautifully written about your observership experience at so-and-so place for 2 or 4 months, and he has explained everything that you did. And honestly, I don't have any questions for you after this. I feel you're a perfect fit to the program. Do you have any questions for me? And honestly, after that point of time, the interview was the other way around. So that is just an emphasis on how important the letters are.
I'll also give an example. So when I did my rotations, and this was almost 10 or 12 years back, I did my rotation at Harvard, and I was working in the bariatric surgery unit, and I was assisting in a laparoscopic bariatric procedure. And the professor, the doctor asked me a mechanism of action of a certain drug. And it was a recently released drug even in America, and I didn't remember the mechanism of action. So I told her I'll get back to her. And as soon as we finished the case, there was a computer console within the OR, and I just searched the mechanism of action of that drug, and I mentioned, and I just told her before she left the theater. And you know, she's highlighted this point in my in my letter, and she's written that, you know, this was his. He's so dedicated to his work that he's remembered that I'd asked him this question, and he told me that the answer to that question before I left the theater. So all this has a positive impact on the residency director. You know, when they read all these things, it has a positive impact on them. So that's the importance of you know, getting a strong letter. So to get a strong letter, you need to do some you need to have some US clinical experience. Now, 2 or 3 things here. When to go for the US clinical experience? The best time is during your internship. Internship is the best time to go for the clinical experience there. Now, when you go during your internship, you will need an extension during your internship. Then only you can go and do your rotation there. Now, there are 3 types of, or basically 2 types of rotations which you can do there. One is known as an externship. Externship and clerkship are almost the same. There's not much difference between an externship and a clerkship. And the second one is an observership, right? Now, externship and clerkship are rotations which are done when you still haven't graduated. So if you finished your internship, that means you've graduated. That means you cannot do an externship or a clerkship. Clerkship or externship is only when you're still a student. Whereas observership can also be done once you've graduated. Now, when the ranking happens, externship is always ranked higher, is much better, is considered much better as compared to an observership, right? Because you're allowed to interact with patients, you're allowed to touch patients, you're allowed to work in the OR. So the more you work, the better letter you get. That is why externships are better than observerships. Okay. Now, nowadays externships have also become really competitive, and even to get an externship, it's almost like a mini application for the residency program. So some of the programs, they ask for a USMLE score, they ask for your TOEFL score, and they also ask for a letter of recommendation, right? So it's good to have, it's good to maintain good relationships with your professors in India, because initially they are the ones who are going to write a letter for you when you apply for your externship programs. Okay, so again, I'll ask Deepansh and Charu to tell us about their externship experience and how did they apply. Just briefly, Charu and Deepansh, how to go about application for the externship, when to apply, and what are the common programs which offer externships to foreign graduates?
Deepansh? Yeah, sure.
Charu, why don't you go first? Yeah, go ahead, please.
Yeah, sure, sir. So just like sir said, I applied for my electives experiences in internship, and since electives are extremely hard to get these days, it's a very competitive process. So a good amount of time buffer should always be kept before you think that you will be able to join them. Ideally you should keep 6 to 8 months before you plan to go to the US, because it needs a lot of paperwork as well as visa processing time. So I started applying to various places in the US, including Harvard, Yale, Cornell, Mayo Clinic, and because I love California, I also applied to a couple of programs in California. You should definitely do a good basic methodological research before you apply to a lot of programs, because a lot of them need USMLE scores, and some of them don't need any scores. So you should always keep your certain documents ready, well prepared, such as letters of recommendation, Indian professors, your provisional transcripts, including a dean's letter. If possible, you should also do your TOEFL exam. If you have not given any step to CS, then your TOEFL is definitely recommended and mandatory at certain places. I did my electives during the first couple of months of my internship, and went to Harvard as well as in Chicago, and later to Los Angeles, California. My experience was pretty nice, and I did all my pediatric clerkships. As medical student, as I got enough opportunities to do hands-on training, and worked in not only on the daily cases and history taking and case presentations, but also on journal clubs and other scholarly activities. So you should definitely keep in mind what documents you need, and keep a good amount of time before, so that you get enough time to process for all the papers, and do not hurry the things.
Charu, so one quick question. Can you talk about the financials? Because a lot of people are asking about the financial aspect involved when you're going for externships. So can you just briefly mention about that as well?
Definitely, sir. Finances is one very important aspect of when you go for electives, because it definitely goes unheard when we think about going to US for our postgraduate training, and when we talk to our parents about it. But it's very important to keep this as a very important aspect. For electives, Harvard is one of the most costliest elective, and Harvard, Yale, Cornell, as well as Tufts, they are almost $3,000 to $4,000 a month elective, which is like a tuition fee. So ideally you should do 2 to 3 electives, so that you can fetch 3 letters of recommendation from US professors. But there are certain places such as Cleveland Clinic, and also University of California at Los Angeles and USC, which need step 1 score, and they don't require any tuition fee. I applied to very selective places, and I was fortunate enough to be accepted at those of my choice. But a $4,000 fee at Harvard and Tufts is definitely costly at that aspect.
All right, thanks. Dipansh, can you tell us about your experience, and can you also enlist a few other universities and programs which offer externships to Indian students?
Uh, as Charu said, the most common ones are Yale, Harvard, University of North Carolina, Mount Sinai, uh, Tufts, and University of South Carolina as well, and UCLA. And I don't think any of the other places. I'm not sure of the places that offer electives. These are the ones that come to my mind.
Okay.
I did my electives at Newark Beth Israel Medical Center in cardiology for a month. That cost me around $2,500 for 1 month. And the other one I did at Mount Sinai St. Luke Hospital in cardiology again. That cost me another $2,000. I understand it's a lot of money. And honestly, before I was going for my rotations, I asked Dr. Rohan if it's worth it, and I got the same answer. Trust me, it's just an investment, and you'll get everything in return. So you should go for 2-3 electives when you're in med school, and once you're done with med school, you need to go through a couple of 2 to 3 observerships, because I know there are a lot of people out here who are done with the med school and are thinking, what do I do now? I will tell them that this is not the end of the road. Keep pursuing this and do your observerships. Do 3 to 4 observership at good places where they take IMGs, international medical graduates, and try to get very good letters. That's what can be done. And even for observerships, there is application fee around application or a tuition fee around $800 to $1,000, or even $1,500 at Wayne State University, 500 at Cleveland Clinic, and 1,000 at University of South Florida, 600 at Washington. So I know it's a lot of money, but it's consider it as an investment. That's it.
Right. So I remember having that discussion with Deepansh when I told him that it is an investment. And when you talk about the financials involved in the exams itself, so just to apply for ECFMJ, which is you get a number that's $65. For step 1 and step 2, it is $880 each. And for clinical skills exam, it is $1,535. So these are just the application fees for the exam plus your travel and your stay there. So it all amounts to a reasonable expenditure, and I would say it is close to around. I mean, if you ask me from the time you start preparing to the time you apply for your residency or you're done with all your interviews, I would say you will end up spending close to around $5,000 to $6,000. Correct me, Dipansh, if I'm exaggerating it a bit. But that is the amount of money which you will end up spending. But trust me, it is an investment, because once you get your residency or you get your fellowship there, per month you're making around $3,500 to $4,000, right? So you will easily recover that amount. Now, just to give you another point of view here, American students, those who are in America, and when they apply for their residency and they match into a program, they are already under a debt of close to 40,000 US dollars. And John, correct me if I'm wrong there.
It's not
So they
40,000,
are
it's 200,000.
200. Okay, fine. Dipansh just gave me the correct figure. So it's 200,000. So imagine the amount of pressure they are under when they are applying, when they start their residency. You don't have that financial burden. You are just spending, say, 6 or 7,000 US dollars. So don't let this cost be a deterrent to your application for the USMLE exam. Okay. So I'll be happy to take any questions from the participants who are there in the Hangout, because I'm already answering questions on Twitter and on the Curofy app. If there are any questions right now, I'll be happy to answer.
Hi, I had a question.
Yeah, Karthik.
So should the research topic be related to the specialty that you're interested in, or can it be of any topic?
So ideally, it should be from the specialty in which you're interested. Ideally, right? But I mean, it, again, if you ask me, if you have zero research topics versus one in a subject where you're not applying, I would say something is better than nothing.
Yeah, right.
Yeah. Any other questions? Okay, right. So we've spoken about research. We've spoken about US clinical experience. So Nitya has just asked a question. What should be the timeline for clerkships in medical college as they have to be completed before graduation? That's correct, Nitya. So you have to apply. So what I tell all my juniors is that, look, November and December is the time when most of the American medical students are looking forward to their vacations, right? So December is the time when their vacations start, their Christmas vacations start. So it's easiest to get an externship in November and December and January. So these are the 3 months which you should target. And they also work well for you, because what happens that we start our internship usually in January, okay? So start preparing for the exam in January, appear for step 1 by August or September, get your step 1 score, and by June or July you should start sending out your applications for a rotation. And if you go for a rotation in November or December, you only extend your internship by a couple of months, which you can always come back and complete. Right? So this was regarding US clinical experience. Now, another very important aspect when it comes to building a strong resume and a strong residency application, and this is what me and Dipansh were discussing before the webinar, that you shouldn't have any gaps in your medical education, right? So a major difference between the Indian and the American system is, in India, it is acceptable for people to take a break of 1 or 2 years and then appear for the PG exam, right? And even if they clear the PG exam after 2 years, they get a PG seat. But in America, what happens? They are looking for the complete package. They don't want nerds who have good bookish knowledge. They want people who have a good personality overall and who can gel well in the system. So when a residency director sees your application, they see whether you've done something or the other in each year of your medical education, and did you apply for your residency immediately after you graduated. So the ideal, if you ask me, a window, it should be within 3 years of your graduation, you should match into the program. That is the best window which you have. If you're applying after 3 years of your medical graduation, then things become a bit difficult for you, right? So no gaps should be there. Now, a few other small things which add up is American research. If you can get research there, and this is particularly useful for people who I know a few examples where they didn't get great USMLE scores. They didn't get good USMLE scores, and they were disheartened after that. But I told them that you shouldn't let go of your dream just because you didn't get a good score. Try to get some research there. And if you do some research for 6 months or a year, that enables you to get some publications there. And it also allows you to interact with a lot of doctors in the system. And these are the doctors who are going to write recommendations for you, and they will also recommend, if you're really good, they will call up their friends and say, look, hey, I have a research associate who's very good, and I think so you should take him up for a residency application, or take him up for a residency, right? So research also helps. And the plus point with research is that sometimes you can get paid research as well, right? So research also helps. And I have a few juniors, Charu and Dipansh also know them, who did the same thing. Although they had excellent USMLE scores, they did research for a year in Harvard, and both of them have matched into good programs this year, right? So research in America also is of great importance. Now, Ananya has asked a question: what is the procedure for applying for externships? Can you say what are the applications to be given for rotation? So we just discussed this, Ananya. You typically require your step 1 score to be on the safe side. Some programs ask for a TOEFL score. Then the third thing which you require is at least one letter of recommendation from your Indian professor, and few programs also ask for a personal statement, right? So these are the 4 things which you require, and you should typically apply 6 to 8 months in advance. So these were some ways how you can build a strong resume. You can also do some extracurricular activities, like you can be part of groups like Indian Medical Students Association or Asian Medical Students Association, and they would be helpful additions in your resume as well. There are certain courses which can be done, like your ATLS course, ACLS course, and BLS course. All these courses, you get credits if you do these courses. Now, just a word of advice, there are a lot of Indian organizations who offer these courses as well. But if you're applying for USMLE, it is best to do these courses when you're in America. Okay? It's best to do these courses when you're in America because you get more credits for that. And another very important thing which you should pay attention to when you're preparing your application, we discussed about publications. So Dipansh mentioned that publications are always better if they are in an indexed journal as compared to a non-indexed journal, right? index journals always do better, fetch you better points when they're considering your residency application. Now, these were a few points on how to build a strong resume. But first and foremost, I told you the most important thing are your USMLE scores. So how do we go about applying and preparing for the USMLE exam? I'll ask Dipansh to do that. Dipansh, just for those who've joined later, Dipansh has just matched into an MD internal medicine program at the University of Tennessee. It's a university-based program. He just matched this year. So he'll just tell you about how to apply for an ECFMT number and what is the best time to start preparing for your USMLE exam. Okay? And Dipansh, I also want you to answer one more question. Some students are asking whether to appear for the Step 2 exam first or the Step 1 exam first.
Just a couple of things that I'd like to clear out initially. Some of the students ask me, is a BLS or an ACLS certification mandatory before you apply for residency? The answer is no. If you have it, it's a plus. It's not a minus if you don't have it. Because every program, before you start your residency, it is a mandatory thing to take your BLS and ACLS certification in the US. So it's nothing to be concerned about, but if you have it, it's a plus. Secondly, as Dr. Rohan mentioned, it's very beneficial to have research in the US, and that is published. But would I say that research is the only thing that is required? The answer is no. Very good STEP scores and a good US clinical experience with good letters will help you get matched even without research. For people who have gaps in the CVs, who have applied like 2 years or 3 years after the year of their graduation, they need to cover those years with some research or some electives or research electives or observerships. Because see, when a US medical student goes out, is done with his medical school, he applies for residency in his last year of medical school and matches into a program just after he's done with medical school. So program directors in the US are concerned about people who've been out of medical school, who've been out of training, a formal training program, because they don't know what they're going to come up with, right? So you need to give them a reason good enough for them to trust you and for them to get you into the program. So just keep those things in mind. And as far as steps are concerned, I feel they're the most important part of your entire application. The best time to give step 1 would be in your internship. I would not say during third year, because once you're not done with your final year, you don't know a lot of your internal medicine, and you would not be able to answer the pathology questions that are asked in step 1. And I would not recommend anybody to give their step 2 CK before their step 1, because a lot of stuff that is asked in step 1, like immunology, microbiology, as well as pathology, is indirectly asked in step 2 as well. So it is always beneficial to be done with the step 1 first, and when you go for your rotations in the US after your step 1, get done with your CS, and then come back, give your CK, and then apply. And try to apply as soon as possible, as close as possible to your year of graduation. That is one thing that you should always take into consideration. And if you have any gaps from your year of graduation, try to cover them up. And honestly, people have a lot of gaps, like a couple of years, and they write that they've done junior residency in Delhi or they've been a part of any NGOs. Trust me, people in the US are smart enough that we can write anything and we can make up anything. So this is another reason why it's always beneficial to be involved in working with NGOs that are in US, like Doctors Without Borders for that matter, or working in US hospitals as observers or research volunteers. Sorry, that took a lot of time.
Thank you, Dipansh, for that. Now, one very important point which Dipansh mentioned there was that you shouldn't try to give false facts. False statements in your application or in your CV, because if you're caught, then you will be debarred from appearing for the USMLE exams and applying to America, right? So don't try to make up or cook up stories about your resume. If you haven't done any research, please don't mention, please don't fill up anything in the research. If you haven't worked for any NGO, don't fill out that you worked for any NGO, right? Because they do tend to confirm these things every now and then. Now he's already mentioned, so what I recommend if you are appearing, so there are 3 exams. There's a step 1 exam, step 2 CK exam, and USMLE step 2 CS exam. Okay. Now if your step 1 exam, this covers your basic sciences. So the first 2-year subjects, excluding forensic India, right? You remove forensic sciences, but what is added is behavioral science. Behavioral science is added. And your step 1 exam is typically an MCQ exam, and it is a single day exam where you have 7 1-hour blocks and you have 38 to 40 questions per block, right? Now, these questions which you get in the USMLE exam are unlike your Indian PG exam. Your Indian PG exam is just straightforward MCQs. The USMLE exams are usually 2-step or 3-step reasoning questions, and they are very lengthy questions. Okay, so I would like to get Dipansh in here for another moment. He's just cleared his exam, so he'll just give you examples of 1 or 2 questions of how they are asked in the exam, and he'll also tell you about the recent changes which have been made in the CK and Step 1 exam.
So initially, when I gave my step 1, there was around 44 or 46 questions per block. But now it's been changed to not more than 40 questions in one block in step 1. And I've heard from people in around me that the length of the questions has increased, and it's always the question is going to be a 2-step question, that you're going to figure out one thing and it is going to lead you to another, and then you have to connect the dots. So you always have to understand the why behind everything. In USMLE, when people do their UWorld blocks, they come and tell me that they've done their blocks in a month and they know everything. But the point is not just knowing the answer of that question. You have to know the 4 other options that are present in the question. You have to read the explanation, because that one question in USMLE in UWorld is your 5 questions that you need to take care of.
So that's he was just giving you an example of how the questions are asked, and they're really lengthy questions. So you have to work on your basics. Basics need to be strong. That is why standard textbooks should be read. Step 1, ideally, I recommend students to appear for the Step 1 exam during internship, because by that time you have a complete idea of medicine as well, and you can get a good score. You can get a good score in the exam. Similarly, I personally recommend Step 1 before Step 2 CK. Step 2 CK is the clinical MCQ exam, which has all your clinical subjects. And another word of advice, there are subjects like psychiatry and biostatistics. These are 2 topics which are given a lot of importance in the USMLE exams, but they're often neglected in our country. Okay?
And ethics.
So, and bioethics. So these are 3 things which you should be very thorough before you appear for your USMLE Step 1 or CK exam. Okay? Is there any question anyone wants to ask at this stage? Any questions? Okay. Right. The third exam is your USMLE Step 2 CS, your clinical skills exam. Now, this clinical skills exam is often the stumbling block for a lot of Indian graduates, and you might have got excellent scores in your Step 1 and Step 2 exam, but I've seen some of, the brightest students failing in this clinical skills exam. Now, the clinical skills exam basically, it's not a test of your clinical knowledge. That's just one aspect of it. But it's more of how you interact with an American patient. and there are some differences between. Suhana, can you just mute your mic because the voice is echoing? There's an option to mute the mic at the top. Can you just mute your mic, please? So the clinical skills exam, thank you. So the clinical skills exam, you basically have 10 to 11 encounters, 15 minutes each, and these are standardized patients. They are not exactly patients. They are actors who are given a script, so they'll be acting that way, and you are supposed to interact with them, take a history, do a clinical examination, and then come up with the differential diagnosis as well. Now, um, I conduct a course regularly for the clinical skills exam, and some of you who are attending the webinar have attended that. So, I mean, I'll let Dipanch and Charu talk about this because both of them are working there, so they'll be able to share more experiences. So, Charu, why don't you tell us about what are the differences when you interact with an Indian patient versus an American patient? And I specifically want you to give the example of a government college like Safdarjung from where you've graduated.
Sure. So I would like to first say that there's just one big difference between an Indian patient and an American patient. The entire medical system is extremely patient-centered in the US. However, it is doctor-centered in India. I do not mean to degrade or offend anyone, but during my internship and all the 5 years of medical schooling in India, I have realized that when we see patients, like the maximum majority of patients which we see in a government setting, we prescribe them a medicine and they do not either they don't ask any question or we don't even bother to explain them what really is the medicine about, except for the fact that how to take it. In contrast to that, when we diagnose a patient in the US or when we go for a clinical encounter, we have to explain them what we are looking for, why we are touching them, why we are palpating them, why we are putting the stethoscope on their chest, and why we are listening to the heart sounds. We need to explain them each and everything, and after that, if we are prescribing something, then we have to explain what this drug is, what does this drug do, and what are the possible side effects that can happen. And we also have to tell them, if this doesn't work, then what will be our next step. So we need to always keep them in a very aware position, in a very open position, and keep it extremely open for other consultations as well. So when you come and if you realize what I'm saying, you would understand that it's all about a communication. So that's the most important point of Dr. Rohan's seminar on USMLE Step 2 CS as well. Because what we really do is explain Indian students, because we all are very educated, we all have a big knowledge base and good foundation of medical science, but we really what lack in is effective communication and interpersonal skills. How we present ourselves, how we talk to the patients, and there has to be a basic manner and etiquettes. How we deal with them is the most important part of a USMLE Step 2 CS exam.
So I'll just give you an example. I had a 50-year-old psychiatrist who come to me from Haridwar, and he wanted to shift to America, and he wanted me to train him for the USMLE clinical skills exam. And he'd already failed the first time around, and I was just generally discussing with him. And I asked him, "Did you ask the sexual history in all your encounters?" And he said, "No, I didn't ask about the sexual history at all." And I said, "That's one big reason why you failed the exam, right?" So, there are certain taboos. In India, we don't like to discuss the sexual history with the patient. But in America, if you don't discuss the sexual history, especially during this exam, and even otherwise, they will definitely fail you in the exam, right? And I was actually talking to somebody who is very influential in the decision making in the clinical skills exam. And, in a single line, he summarized that who are the candidates who fail the exam? Any candidate who creates a blunder which will be life-threatening for the patient, or he misses out on a fact which can be life-threatening for the patient, like allergies, they are the ones who are likely to fail in the clinical skills exam, right? So these are just some examples. Of course, the clinical skills exam, that's a separate seminar altogether. So that was just briefly touching all the three tests, all the three exams. And once you clear these exams, you get an ECFMG certification. Once you clear the step one.
I would just like to add one more point, Dr. Rohan, if it's possible.
Sure. Yeah, absolutely. Please go.
just for the students who are about to appear for USMLE Step 2 CS exam very soon, apart from all the points that Dr. Rohan sir has touched upon, just like to mention that counseling is very important and a very important aspect of any encounter in a patient. When you deal with any, when you complete any patient encounter, do not forget to counsel him about his or her basic health, human health. Be it if it's an asthmatic patient, you need to counsel about what really can affect or exaggerate the asthma attack. Or if the patient is an obese, then you need to tell him or her about cardiovascular risk and side effects of being obese, or how to lose his weight and what are the common sedentary lifestyle effects that he needs to work on.
Correct. That's absolutely correct. That counseling is an important aspect of the clinical skills exam. Right. So once you clear these 3 exams, you get an ECFMG certificate, and the ECFMG certificate is very important when you're applying for the residency exam. Now, I won't say that it is mandatory, but yes, for a foreign graduate, it is quite important that you get your ECFMG certificate before you apply for the residency. Now, typically, application for the residency goes in September. And before you apply for the residency, there's a very important thing which you have to do, that is a personal statement, right? And because Dipansh has just applied and got a residency, I would ask him to elaborate on the personal statement and also the process of applying for the exam, for the match, I'm sorry.
So there's one thing that I would like to add, that interpersonal communication skills are required for the CS. I would absolutely agree on that. But even during your rotations, what you will not be assessed on the basis of your medical knowledge, as is the scene in India, but you will be assessed by the way you talk to your patients, by the way you talk to your fellows, with the people around you, because they want somebody who can gel together, who's a good person, who can communicate effectively with the patients and with the fellows, with the attendings, with the residents, and who is happy to be around. They would not want somebody who's a douchebag to be as a part of the team, because he is going to be involved in the patient care and the decision making 12 hours a day for the next 3 years. So that is something that you need to take care of, the way you talk with your colleagues and your patients as well. And apart from that, personal statement is definitely one of the most important things while applying for a residency match. When you apply for your match, you need to upload an application on ERAS, for which you need your step scores, your letter of recommendations, and your personal statement. And you need to check the programs that you wish to apply to, and the specialty that you're thinking of applying. So your personal statement will be read by every program director, and it is probably one of the filter criteria before, if you pass the filter of score and a good letter, then you might be rejected just on the basis of a poor or a not so good personal statement. So this is something that you need to be concerned about. When you write a personal statement, you need to address a few things. Why which specialty that you're applying to? For example, why internal medicine? Why US healthcare? And why did you want? And what did you do that they should really take you? That you do not need to mention whatever you've done in your CV, but you need to mention that what have you learned from whatever you've done in your CV, from whatever you've learned from your rotations in the US, and how it has helped you to grow as a person and grow as a medical professional. So you need to highlight these things you need to keep these things in mind before you write a personal statement. And remember one thing, that personal statement cannot be written in one day. It is something that will be edited at least 5 to 10 times, and it needs at least a month or so. So please make sure you give enough time for that. That is one thing that I would like to emphasize at this point in time.
Right. So, any questions at this point of time? If there are any questions, we'll be finishing in the next 10-15 minutes. I'll be happy to take any questions. I'm already answering questions on the app and on Twitter. So, if there are any questions from the participants here.
Dr. Rohan, there is a question which is being asked to me on Twitter.
Right.
if you may allow it.
Yeah, sure, absolutely.
The question is that what is a better option, observership versus research in the application period of the season?
Well, I mean that's slightly difficult because everyone would have their own opinion on that. But if the research is for a prolonged duration, if it's a research which is for at least 6 months or more, and if it's culminating with a few publications, I would give it more importance than a month-long observership. But again, I mean, I'm sure other people might have different views.
Thanks.
Any other questions? Okay.
Just one thing. If you have any research experience that you've published, you can always enter it before September 15th. But once you're doing any research after September 15th, you can only go to your interviews and tell them that you're working on so-and-so research and you've managed to get a publication or a poster presentation at so-and-so conference at this point of time. But uh, if you are doing your observerships during the time of interview season, you might be able to get in touch with the chief resident or the program director, and you might even ask them for an interview call, and you might get one. So both of them would be beneficial. I would not say one is better than the other, but it's a personal call, as sir said. Yes.
Right, so just to go over some of the questions which are being asked on the Curofy app, is it possible to do general surgery residency in America? So yeah, these are two things which I want to cover. So look, there are certain subjects which are easy to get there, like you have family medicine. Now, family medicine is typically a combination of, it'll have bits and pieces of OBGYN, pediatrics, internal medicine. So family medicine is easy to get, psychiatry is easy to get, pediatric, then comes pediatrics, then internal medicine. And these are the four which foreign graduates easily match into, right? But at the same time, I wouldn't like to discourage people who are preparing for surgical branches. Surgical branches are a bit difficult. They are not impossible. And trust me, no branch is impossible there. I have friends, and of course seniors, who I know somebody who matched into a radiology program when he was 36, and that's how dedicated he was. And he matched into a radiology program after finishing an internal medicine residency. One of my batchmates, she's got a dermatology residency there. And I know many people who are doing general surgery residencies as well. So it's not impossible, but yes, you need a very, very strong resume, and you need, so most of these surgical programs, they have a pyramidal system, right? So you have something what is known as a preliminary year, where you work there for 1 year, and then after 1 year, then if you're good, they'll choose you for the categorical program, which is the complete program. So for most of the surgical residencies, yes, you do have a pyramidal system. It is difficult but not impossible. Another question is regarding neurology residency. So neurology is a separate residency altogether there. It starts off as a separate residency. It is also a competitive residency, but you can get it if provided you have adequate research and a strong resume. So that was regarding one thing. Then a few people have asked about fellowship options. So there are two types of fellowships. You have accredited and non-accredited fellowships. Now, ideally, if you have your USMLE scores, it is easier for you to get a fellowship. Like I did a fellowship after doing my surgery PG from India. I did my fellowship there. So if you have your USMLE scores, they are helpful. The scores per se don't matter that much, but you have the ECFM certification that is going to give you a lot of benefit when you're applying for these fellowship programs. You have to come back to India after once you've done your fellowship programs, and you can work here. There are a lot of corporate hospitals who favor doctors who've done their training from abroad. Another question which a student has asked is that if they do their residency there and then they come back, are they allowed to practice in India? Yes, you're allowed to practice in India, but at present, MCI doesn't recognize your American residency. So you will just be a glorified MBBS on the in the register, right? But you have all the skills to practice as a specialist doctor, and you can practice whichever subject in which you've trained there. So these are just some questions which are asked in the Curofy app. And there was one question about J1 and H1 visa, and Deepansh, if you can just enlighten us about the J1 and H1 visa. And there was also a question about the bond which the Indian government is making people sign these days. So can you just tell us about that as well?
So J1 is a student and exchange visa, and H1 is a work permit visa. Obviously, H1 is a better visa any day, and for H1 visa, you need to get done with the step 3 as well. But it depends on program to program what they offer. Most of the programs sponsor J1, but yes, there are a lot of programs that still sponsor H1. As far as J1 is concerned, you need a statement of need or a no objection certificate from the Ministry of Health and Family Welfare in India. As of this date, the people that applied with me for a statement of need, everybody has got their statement of need, and nobody has been denied a J1 visa. And because it is being sponsored by ECFMG, because once you've matched, it is kind of their headache to get your visa done, and trust me, it's not something to be concerned about at this point of time.
And
but yes, I would definitely say that H1B visa would be better in terms of getting a green card or a citizenship in the US. But most of the university programs do not sponsor an H1 visa; they give a J1 visa. Yes.
Right. Okay. Perfect. So, any questions at this stage? We're just about to wind up. Any questions? I'll be happy to answer them. So I guess, in today's webinar, what we've discussed, we've laid a lot of stress on how to build a strong application for the USMLE residency, for an American residency. And number one would be good scores. You need very good scores. For that, you need a strong base. And preparation for that starts right in second year by reading first year by reading standard textbooks. Don't be in a hurry to do MCQs. You can do MCQs later on when you're preparing for the exam, but do read standard textbooks. That's important. Get involved in some research work in India or your native country. That is going to help you. Try to get publications out of research. That is what is very important. Third, US clinical experience. You have to go during your internship and give yourself a 6 to 8 month window and have a personal statement, a letter of recommendation, and preferably your USMLE Step 1 scores ready with you when you're applying for a rotation. And externships are better than observerships. Okay? US research experience, if you have time and if you can get it, that is also beneficial. Your personal statement, which Deepansh has spoken about, many iterations are required, but your personal statement is something which tells the program director about you, so they are also, you should spend adequate time on them. And we've covered a lot of points regarding the frequently asked questions regarding this exam. So I think so we will end this webinar here today, and we will conduct a part 2 of this where we can take one aspect in detail and discuss it further. If the video of this webinar, the recording of this webinar would be put on YouTube. So those who've missed out, your friends or your colleagues, you can always ask them to watch that. And my email ID is rohankhandelwal@gmail.com. And you can also download the Curofy app and you can ask your queries through that. I would like to thank Deepansh and Charu for joining in and helping out in this webinar. We would require your services for the next webinar as well. Now, before we sign off, if there are any questions, we would be happy to answer. Right. So just some concluding remarks from Deepansh and Charu, and then we'll just finish the webinar. Deepansh.
Okay. So I know it's a long journey. It requires a lot of determination and a lot of time and money as well. But trust me, you can reach there if you're determined enough. That's it. I was in a similar situation as you guys are 2 years from now, as I've said previously. But I have got a lot of good guidance from people around me, Dr. Rohan, my parents, and a lot of others, my friends as well, and the people around me who have matched and who haven't matched as well. So it's a long process. You need to get in touch with the people. You need to build on your interpersonal communication skills, and just be persuasive enough. That's it. It was good talking. Thank you, Rohan sir.
Yeah, so I think that Deepansh has mentioned a very important thing. The whole process here is unlike your Indian PG where it's a single day exam. Here it's a year and a half or 2 year long process, and there will be many ups and downs, right? So you need the support of your friends and family during the period when you're down, and you really need to capitalize on the periods when you're on a high, right? So it is a long and arduous journey, but the reward is well worth it. Okay, Charu, any remarks from your side?
Concluding remarks would be the fact that as it is a long journey, you need to be passionate about what you're doing. Just don't follow the group who's doing USMLE and you want to settle in the US because of better money and work opportunities. It is not a case like that. It is definitely an added advantage, but if you are passionate about working there, you will definitely match into your wish of specialty or your desired specialty. Uh, Apart from what all we have discussed, the exam, the personal statement, the letters of recommendation, I would just add a point that don't have a lot of gap after your medical education, since almost 70 to 80% of the programs now keep a barrier of 3 years of graduation. If there is a barrier, then please do some community service because it's very important, especially in the United States, to show your passion towards a desired specialty and working for the underserved or a county hospital. So it was nice talking to all of you, and you are more than welcome to ask me any questions whenever you have. Thank you, Rohan sir.
All right, thank you. So just to conclude, we are going to have more webinars like this on USMLE. Me and a lot of other people who've cleared the USMLE exams, we will be writing regular tips on the Curofy app. So Curofy for students, that's the hashtag which you can use to get an invite to Curofy if you're a medical student. If you're a doctor, you're free to join the app. And if you have any questions regarding this webinar, you can always send them to me on rohankhandelwal@gmail.com or through the Curofy app. Thank you very much for participating in the webinar. Good night.